started and pull up my notes. Okay, it's funny. I actually do a clap to help with syncing the audio and video.
hmm
Okay. All right, here we go. Yeah, there is a little bit of a delay, but I'll be able to fix that later.
Okay.
Okay. Greetings to everyone out on the internets, and welcome to another episode of Hashtag Real Talk with Aaron Bragg. I am your guide through this fog of information security. Today's guest is someone that I've had the pleasure of working for, I guess, both, for almost 4 years now. His name is Jim Kuiphof. Jim is the Director of Information Security for a major healthcare organization here in West Michigan. Jim, I'm very glad that you finally caved into my request to do a podcast. Can you tell me a little bit about yourself and what you do at this major healthcare organization?
Absolutely. Well, thanks for having me, Aaron. I really appreciate the opportunity to talk to your listeners about information security. I've been in security for almost 20 years, and it's definitely a passion of mine and continues to be. The other thing that's a passion is leadership, and that's one of the areas that we all can improve in is our individual leadership, whether that's at home or in the business world. And so I've tried to hone my leadership skills through the years, and that's I think how we met was through some mentoring opportunities at the place where we work. So yeah, I am the director of security operations. So I have responsibility for um, all of the cyber threat management. That's everything from identifying threats, proactively remediating those threats through like patching, vulnerability management, those types of things, and then all the way through the continuum to full incident response when something doesn't work right and a threat is realized within the environment, responding to that threat. In support of that incident response capability, then I have responsibility for security engineering as well. So building out secure solutions, secure security controls, engaging with the rest of the business to make sure they're building out secure environments. And then on top of all of that, I also am responsible for the budget for the security program. And then I also manage a portfolio of transformational projects as we try to respond to the threat environment and the changing business landscapes to enable the business to operate in a secure way.
Which has been obviously quite a challenge with everything that's going on right now.
Sure has been.
Which brings me to a first question for you. You and I kind of talked a little bit in our mentoring session about this and just how it's strange right now. So one of the things that you said was, what can't you do right now as a security leader when like a pandemic
Right.
or a business crisis is going on?
Yeah, and that's one of the things that you're hearing in the news a lot, and it's maybe a little bit counterintuitive. Um, Healthcare in particular is under significant attack because of the COVID pandemic, and threat actors really go after anything that will get you to respond emotionally. That's why in a lot of phishing attacks you see financial motivation, right? The letter from Nigeria saying you have $1 million in a bank account, send us 5,000 and we'll release it to you. Those are ways of getting you to respond emotionally. Well, a global pandemic is a perfect way to get people to respond emotionally. So what we see is a lot of threat actors trying to take advantage of the scare right now to get people to respond emotionally. And so we also have businesses that are responding emotionally to the COVID pandemic and the threats that they're reading about in the news. Um, my maybe slightly counterintuitive approach to that is really if you're in a business that is having to respond to COVID, so if you're not fully shut down, um, it really is not a good time to try to bring forward a full security program. Um, I I like our posture in that we were actually able to support the business by lowering some of our security posture to enable the business to be more agile in response to the COVID crisis. But at the same time, we had enough maturity to be able to document those areas where we accepted the risk, lowered controls to enable the business to respond in a more agile and nimble way. So if you're looking at this crisis saying it's a perfect opportunity to get new funding, right, to implement new security controls, to build a bigger team potentially, I would caution against that, right? It's likely that once the fog of this crisis lifts, and we're already starting to see that a little bit with some of the shutdown orders letting off, there's a good chance that the business realities of this are going to set in, and we're not going to be able to do a lot of hiring or implement new security controls or other things. So really, it largely depends on the business that you're in. But I would, like I said, caution against a wholesale change or a radical shift in strategy from a security perspective. The flip of that then is, well, what can you do, right? And really supporting that business, understanding where the business is going, and really forging those relationships with the business leadership. Those are the relationships that will actually enable you as you come out of the crisis on a security team to do the right things then and do them in a systematic way that's measured and repeatable and consistent, and builds a team and builds a cohesive, secure organization. So one of the things that I had hinted at that I think is super important is really when the business is moving agilely through this crisis, be right there with them if you can to document the risks that have been accepted so that you can come back later and clean them up. In our case, in healthcare, the FDA is really changing almost daily some of the rules and regulations for healthcare insurance and healthcare providers. So keeping up on those, understanding what that looks like, documenting, when the business is making decisions and partnering in that way.
Which brings up a good point, because that relationship you're building by allowing the business to move quickly and then documenting it later will help when you have to do some of that cleanup, right? Because
Yep.
it's been that trade-off. I mean, you and I've been on a couple projects that where, around the virtual visits and virtual healthcare, where we really didn't have a choice. We had to slam those in, right? We needed to move quickly, and leadership, to our credit, our leadership's credit, they really embrace that. And then having that risk register, so to speak, like you said, as things slow down, we can go back and take a look and then truly understand the risk on those. So that's huge,
Yep.
because I'm sure there are probably peers out there that maybe even have reached out to you like, oh my gosh, I wanted to do X, Y, and Z, or my executive leadership is all of a sudden worried about X, Y, and Z. We need to get this right in. And then to your point, trying to slam something in while you're, especially in healthcare, trying to take care of patients and being nimble just could spell disaster.
Yeah, that's exactly right. And the one thing that's always difficult, security has historically been seen as the department of no. And at this time, during this kind of a crisis, really as an industry, we can't be seen as a department of no. And that really depends largely on those relationships you've built up until this point. So one of the things that we had talked about last week was that you really don't want to try to put in a lot of disruptive controls at this point. So if you have decent security controls, make sure those are running well. Make sure you've implemented good monitoring controls so that you can actually see what's going on, even if you're not preventing or stopping the bad activities from happening. So I think there's a lot of opportunity during this time, but I think it needs to be measured so as not to disrupt the business. And in our case, it's healthcare, so we have to be super careful because the community's health is kind of in peril and in jeopardy, and we don't want to be seen as impeding the ability of our healthcare providers to complete that work. But at the same time, we do want to enable a secure posture, right? And so if you have a control, if you have multi-factor, make sure that's running well. If you have email security, make sure that that's tuned well and that you're eliminating false positives, right? If you have a patching program, absolutely continue to execute that patching program and make sure it's done well. But if you don't have MFA, now would probably be a bad time to implement MFA, right? If you've got a whole bunch of remote workers and you're suddenly going to make them log out and log back in, that can be very disruptive. So it's a balance. just like most security is a balance, right? We don't have unlimited budgets. We don't have unlimited ability to disrupt the business, so we have to be careful. And I think that's the key to this particular item is let's just make sure as a collective security community that we are supporting the businesses that we serve to enable them to do secure work as secure as possible during this time.
Excellent.
Yeah.
So I'm fortunate enough to share a couple stats that are kind of hot off the presses, and our leadership allowed me to talk about these publicly, which I think is huge because it talks to the digital surge. So one of the stats that I saw that came out of this were around, things that didn't exist a couple months ago. And I'm going to get into this in a little bit more of a healthcare security webinar soon. But for the sake of our conversation, there were two things that literally didn't exist at Spectrum Health 3 months ago: employee screening and like chat bots. And that ties into some of the data that we saw from those things. The surveys, there's over 800,000 employee health surveys completed since March. The chatbots, 16,000 users were triaged since March. These are very forward, very, like you said, agile technologies that didn't exist. So how do you lead a team and maintain vigilance in a time of radical change? Because like I said, those didn't exist in February. All of a sudden, our awesome digital development team came in, they slammed those stuff in, they did work with us. But what do you say to your like engineers and even consultants like myself? Like, how do you maintain vigilance?
Yeah, no, that's a great question, Aaron. And I think you hinted at there's two parts really to this answer. The first part is forming good relationships between the business and security prior to crisis happening, right? If you look at the NIST model, planning is one of the key tenets of a good security program. And I think we're seeing that play out right now where if security was seen as the department of no prior to the COVID crisis, the business leadership, senior leaders are just going to go around security. They're going to do stuff without involving us. And that's a really scary spot to be in because who knows what's being deployed, what contracts are being signed with third parties that maybe should have no business holding or processing our data, right? So we were in a great position having formed really robust connections from the security department into the rest of the organization to where they felt like they could bring us along as a trusted partner, if for no other reason to document what's going on and support them in that change. So yeah, absolutely. It's inward focused and outward focused. So how do you maintain vigilance in the support of the business as they're moving very fast to the point of even, you maybe under normal circumstances raise your hand and say, wait, this maybe isn't the best vendor to go with. Maybe this isn't the best architecture for this particular data collection solution. But we have to be there, be partnered, and like you said, maintain that vigilance to support the business and support our team. So COVID, if nothing else, like a crisis, really is change. And if you think about how you manage change as a leader, I think that really starts to answer some of those questions about how do you maintain vigilance. So my personal goal, as we support our teams as they're supporting the business, like you, Aaron, is really to be present, right? To communicate, almost over communicate, listen to our community, listen to our employees, understand where the concerns are. And then I think another key part of that is being vulnerable, right? I'm not a machine, I'm a human. I have fears and uncertainty as well. So being able to communicate that in a transparent way is really a very tangible way to be visible, present, and understand the team. And on that last point, I think that's the key to maintaining vigilance. Actually know every person on your team. Every individual will handle stress and change in a different way. And understanding who each individual is on your team is critical to being a good leader in a time of change, in a time of crisis. So I would actually encourage every manager listening or every team lead listening, create a plan for each of your team members. As they transition, it's probably too late now as we transition into the COVID crisis, but as we transition out of it, that's that's another change, right? And we're talking about radical shifts from in-person working to remote working for knowledge workers. That's going to be another adjustment for people, right? In crisis, it's one thing. There's a a an out. There's an exit at some point where we will supposedly go back to normal. What if that normal never comes? How do your team members handle
Good
that?
point.
So knowing each individual, knowing which individuals can handle the change, and then create a plan for each team member, right? My managers and I talk about this frequently. We talk behind your backs, right? We try to understand how to best
In a good
support,
way.
yeah, in
In
a
a
good
good
way.
way.
Well, and I know you guys talk about us behind our backs too, but
Fair.
so
That's fair.
knowing how to support each individual employee and having those conversations, both one-on-one and in a group setting, to understand what we have to do to make sure the team is supported, comfortable, and maintains a high performance throughout the crisis and after.
That's a that leads to a different question. I'm going to diverge here for a minute
Okay.
because I think it's super important for the leaders that are listening. Are you finding that you have more time to pay attention to some of the details because you're not, having to do a meeting in the car along the way? You're, yes, you still get, you
Mhm.
have some young kids, you still could be interrupted by that. But overall, are you finding life slowing down a little bit and that allows you to pay attention to little things? So, I mean, you guys have been very good leaders, throughout this, but I mean, if the attention to detail can increase,
Right.
I think that can help kind of bridge the gap, without having that face to face. Does that kind of make sense?
It does, and the thing that just sort of jumped out at me is um, having a good leadership team so that you can cover for each other. And I'll give you a perfect example that's relevant literally right now. My wife and I decided last fall to rebuild our house, to remodel. It's a pretty significant remodel. It's like a rebuild. Um, that leaves me distracted often, right? And my leaders know that. My co-directors leaders know that. My co-director knows that. My boss knows that. And we're honest about it, right? Hey, look, I've got some subcontractors showing up. I got to go meet them, right? Can you cover for me? Can you, handle this team meeting? Can you work with this particular, whatever the particular urgency in the moment is? We cover for each other, and we're honest and transparent, right? We live lives as well, and so, yeah, being remote absolutely has provided a level of flexibility that we didn't have before, and now we have the ability to, you know, spend time spend more quality time thinking about our leaders, our employees, the strategy, what's going on. Not that we didn't do it before, but I just feel like we have a greater opportunity now to take advantage of no commute, no I don't have to worry about putting a suit on every morning, right? I don't. There's a lot of things we don't have to worry about, and just making sure we're filling that time in a productive way, I think, is the challenge for a disciplined leader to stay disciplined and stay motivated.
Well, I know there's a lot of people worried about like working too much or
Yeah,
working too little and things like that, but what you're talking about could be a positive for all this, right? Like I mean, it might be okay, schedule a half an hour in your day because you have to, run to the store for your kids or something that
right.
traditionally you wouldn't have had to do if you were at work. But then the trade off is, hey, you have it's 7 o'clock on a Tuesday night and, the kids are mellow and you can make up that half an
Yep.
hour or you come up with an idea and you can go to work on it. I know some people want to say, hey, I don't want to, especially in security, right? I don't, especially with a SOC, I don't want to have to work 24 hours. But I think you bring up a good point is this forcing people to have a better work life balance in information security?
Yeah, being transparent and sort of autobiographical. When we first shifted to 100% remote work, it was a bit of a challenge. Not from the standpoint of staying disciplined, but just from getting into healthy routines. The biggest thing for me, my office is 30 plus minutes from my house, so I had a 30-minute sort of mental prep time that I got in the habit of taking advantage of. That was the commute, right? Heading into work, leaving home behind and heading into work and planning my day during that 30-minute period, and then coming home, leaving work behind and shifting into the husband and father mindset. I didn't have that, right? And that went away very quickly when we transitioned to 100% remote work. So really putting that routine back into saying, okay, I'm disconnecting now. I'm shutting down. I am going back into husband father mode, not boss director mode. And it sounds maybe cold and calculating to think that way. I'm still all of those people all at one time, but yet there needs to be that conscientious mental move away from a particular way of thinking. If I try to be a director for my wife, it's not going to turn out too well, right? If I try to be a father to my employees, it's not going to turn out too well. So there's a lot of leadership that carries over.
It depends on the situation,
yeah,
though, right?
It does. Well, and that's what I said. There's a lot
There are some times you've had to say,
Yeah.
Aaron, settle down.
There's a lot of carryover, and I don't mean to say that it is truly black and white. It is a continuum of color, and knowing where you're at, I guess, and being a conscientious leader to recognize I'm in the wrong mode and I need to adjust my thinking is an important introspection that leaders need to have.
Oh, that's an excellent point.
Yep.
So it's almost a good segue into the next question. What are some of the security challenges that we're going to see with more remote medical devices that are needed to accelerate virtual healthcare? So you talked about the remote work and going to 100% remote work and those different types of challenges. One of the things that we've seen and is a decree from our leadership, right, is we're going to accelerate virtual healthcare. It's almost like they got a taste of moving quickly, and we do have some very forward, technology minded leadership right now. We're very fortunate in that. But it's going to put a set of unique new challenges on us and for information security, because say this, particular device used to be used in the clinic. Now we got to push it out into the field, right? Whether it's being taken there by a home health nurse or, something maybe we just shipped to them. We got to secure those devices now. So what are some of the challenges you think we're going to have in the future?
Yeah, no, absolutely. It's an interesting time, I guess is the best way to say it, as we shift from, sort of the in-person traditional model of you go to your doctor and have a conversation, in the same room with them, to not only a need but an ability to move to a remote work situation for these healthcare providers, and virtual healthcare is a huge part of that. So it's an adjustment from what I think we're used to. That's the first challenge, is just understanding it's change. And someone like, your folks or my folks, they might struggle a little bit with that change. And that has nothing to do with knowledge level or experience or ability. It's just what we're used to. And so really working with and understanding our communities and leading in the community to make sure we're promoting the why behind the change. In the acceleration of virtual healthcare is a huge part of that, being able to put a blood pressure monitor on your wrist and wear it 24/7. We've been able to do that for specific diagnostic reasons in the past, heart monitors, things like that. But this is really increasing to a whole different level and a whole different availability. The bio monitoring that really, I think, is going to change individual healthcare through the virtual opportunities.
Well, you have connections like with NHISAC, and you were one of the people that pointed out to the MD Viper program, which is around securing medical devices. So the FDA, to your point, the FDA and others have started to take security more seriously.
Right.
But do you think things might go backwards a little bit because of the rush out? Like you have, a sleep study device or.
Right.
A blood oxygen device that now, a manufacturer's like, hey, we can quickly transition this from using it in the office to tossing it out, and then we'll feed the data from the cloud.
Yeah.
Do you think we could go backwards as far as like some of the government regulations of holding these medical vendors' feet to the fire?
Yeah. Yes and no. I think if it's a personal choice, individual freedom is going to trump government regulation, from the standpoint of I want access to my data And I know that it is not nearly as accurate as maybe it would be if it was a clinically certified device, but it's still valid. It's still
Interesting.
relevant, right? So if
Okay.
I want to wear a heart rate monitor on my wrist and I know that, look, the blood pressure cuff in the office is going to be, you know, 5 decimal points more accurate than the thing I've got on my wrist, but I only do that once a year with my healthcare provider during my annual physical, it's a choice that I think I should be able to make, right? The question I think
Fair
becomes,
point.
yeah, the question becomes when we look at the security around that data, and then the security of the data population that data might need to feed into. So in our case, we use Epic as our EMR. Is that data we want in our EMR? Is there a way to flag that data as coming from a less accurate source so that if a provider were to see that, they could make a determination, again, based on risk, right? The risk of
Yep.
misdiagnosis based on inaccurate data is there.
Yep.
Um, but then from a security perspective, we're looking at it saying, well, how is that interface secure, right? How are we preventing someone from maliciously manipulating that data as it comes into the environment to manipulate insurance payments or treatment options or drug, prescription drugs, things like that. So really, how do we secure, how do we get the individual device more accurate? How do we get the single user data stream coming out of those devices secured? And then how do you protect all of the data in the population that data stream is feeding into, in our case, like the EMR? And I think those are huge challenges that we're going to have to address as a medical device community, as well as a security community, and then an EMR community as well.
So that brings me to like data and data
Yeah,
security. So you and I briefly talked about, a crazy idea that I had around data as data having an identity, right?
right.
I know that I have some architect peers that look at me like I'm crazy when I say that, but when we talk about maybe using metadata in a different way, it could go back to what you said. That doctor, if we're tagging something correctly, the doctor can see that this is my remote blood pressure monitor. And then you said he can take things with kind of a grain of salt, but overall the data is going to same. Even if there's
Right.
a device variance like you're saying, if it's way high, he at least knows it's way high, right? He may not be concerned that it's 150 instead of 153 over 100, let's say, but he knows something's going on.
Right.
So you kind of talked about simple versus simplistic. If we move to like data having identity,
Mhm.
can you talk about that a little bit? Because I thought that was very valuable.
Yeah. So the concept, Aaron, that we talked about before with simple versus simplistic, it really comes down to distilling very complicated concepts into communicable and understandable um, concepts. Then, as you come out of that, and medical device security is a complex thing to talk about. Communicating that to a population of commodity users, your Apple Watch users, and really consumers in general, the full understanding, the deep understanding of how to secure a medical device really isn't necessary. But at the same time, we need to be accurate when we summarize that, and that's really the difference between simple and simplistic. Simplistic is you dumb it down to the point where the meaning is lost. Simple then is you pare it down into the core essence of what is actually required to make good risk decisions, um, without losing a lot of that meaning. And that's the art really of communicating around this. And what we had talked about before was sort of internal messaging, right? How do we take an architectural concept that's very difficult to understand and distill it down into its core essence so that a senior leader can grasp a hold of what's actually at risk here and make good risk decisions based on that. We don't want to do that simplistically. That's an insult to their intelligence. Just like simplistically summing up using virtual, health and the risks to an end user population of virtual health would do a disservice to our individual users' ability to make risk decisions for themselves. So we need people that can really distill complex topics down into simple to understand, but still profound, and communicating that meaning concepts then as we go forward.
So you kind of broke that down for me, and you challenged me to kind of think of the who, what, and how
Right.
differently.
Right.
and you had a good use case for like board members. Can you talk about the board member use case?
Yeah, you might have to refresh my memory a little bit on that one.
Oh, okay. So if the use case was around if a board member is getting their board information from their home
Right.
computer, then they can only get, say, like a read only or different policy controls for different data use
Yeah.
cases.
Yep. Yeah. What we were talking about there is this idea that uh, there's hooks that we need from a security perspective to make good policy decisions around who can access the data, how they can access the data, what they can do with it, from where they can access it. And that's the board member example that we used before was really if they're accessing it from the secure board portal, for example, that would lower the risk. If they're accessing it maybe from their OneDrive, that would increase the risk, right? If they're accessing it via a VPN into the corporate network, that would lower the risk. If they're accessing it directly from a coffee shop Wi-Fi, that would increase the risk. If they're domestic, on U.S. soil, that lowers the risk. If they're in China, that raises the risk, right? So there's all of these different ways of defining the policy around a particular element of data, be that structured or unstructured, that we can then use to make security decisions on who can access it, how they can access it, and what they can do with it.
Yeah, because you talked about, you know me, I get carried away with some ideas sometimes. So I
Yeah.
was coming up with different ways we could, use metadata tag stuff. And you cautioned me a little bit because you said you don't want to classify every single document in granular detail.
Right.
And you talked a little bit about classification and categorization.
Correct. Yep.
So can you talk about that?
Yeah, absolutely. So I think everybody's probably very familiar with the idea of classification. So it's confidential, it's public use, it's internal use, right? We generically bucket types of data up to make security decisions based on. For the most part, that's actually an effective way to get started down the data security path. But I also think we need to start looking at how do we layer in the categorization of data. So is it HR data? Is it EMR data? Is it business critical data, right? And as you start to layer in then not a lot, right? A half a dozen different categories as well as the classification. Now from a security perspective, we can make very fine grained and granular decisions based on who can access that data and what they can access and do with it. So really kind of evolving and creating this idea of a matrix almost of a security policy around the data types. I don't think that as an industry we're ready for that completely yet. I don't think businesses are completely ready for that yet. But as we start to move towards a more virtual workforce, accessing data literally from anywhere, we need to really start defining what those things look like and how we can go about correctly allowing the right people access to the data at the right time.
Which is huge because I see in some circles that people don't even want to call it work from home anymore.
Right.
They're starting to use the term that you talked about, work from anywhere.
Yeah.
So
Yep.
which I'm okay with because I'm a traveler. I
Yeah.
would love to be able to work for like 6 or 8 hours somewhere in Ireland and then
Yeah.
then take the next day off and not have to worry about it.
Yep.
So that kind of helps with what I was trying to solve. So you're basically saying with proper categorization, and then like using like geofencing and geolocation, then you could change that PDF to be read only because hey, I'm in Ireland
Right.
and I'm accessing it, through a public internet terminal. But yet, if I was home, here in Michigan, then I could have more features.
Yep. Maybe you
That
could
would,
maybe you could email it or copy it or do something like that versus if you're, overseas, you can only open it and view it in a web browser, for example. Something like that. Yeah. The flip of that is always going to be the complexity of the security policy. If you've got too many options, the security policy becomes really unsustainable in terms of the number of permutations that you have to manage, the number of data elements that have to be managed. So it's really that balancing act between securing the data and enabling the business to use the data dynamically without having a human to be involved in making those policy declarations around the decisions that were already made.
So what you're trying to tell me is AI and machine learning isn't going anywhere.
Yeah, exactly. Exactly.
All right, we're at about 35 minutes, and I try and keep these not too
Yeah.
long. So can we finish up with you giving us maybe a small sneak peek of
Yeah.
your CloudCon Grand Rapids presentation?
So do you want one maybe more specific example, or do you want just a broad overview of what I'm planning to talk about?
I think maybe one specific example of a topic I really think people would want to hear more about.
Okay.
Maybe like you call about security in the trench or security warfare in the trenches, or you got an awesome tag. So what's like a little hook to get people to want to know more?
Yeah, so I'm titling the keynote "Leadership Lessons from the Cybersecurity Trenches." So if I'm a history buff, World War II in particular, Vietnam War, there's leadership lessons to be learned by looking at war. I think cybersecurity is actually a form of war. It's a form of combat. So I think there's a lot of parallel lessons that we can learn by looking at really great military leaders as we move forward. So I've got 6 different events that occurred that I was either a part of, led, or managed. The teams as they responded to those events, and each one of them is a unique event in terms of the risk, the vulnerability, the threat actor. All of it comes to play in a unique way to really draw out some leadership principles. So the one I'll quick highlight. Many people listening to your podcast have probably either directly dealt with ransomware or know somebody that has dealt with ransomware. Um,
Mm-hmm. Mm-hmm.
we have had ransomware where I work, and every time it's been contained and controlled because of our security team and our posture. In one particular event, it came in through a novel channel, and you have to tune in. You'll have to come to CloudCon to get more detail around that. But suffice to say, it did not come in via email. It did not come in via thumb drive. It did not come in via a web-based attack. It did not come in from vulnerable RDP. It did not come in from any vulnerable host on the internet. It came in through a novel way. And the way the team responded to that threat to find patient zero, to find the first indication of what we were dealing with, and then to decompose it, and then very rapidly form a response plan to that, and then go execute that response plan. That all happened within, it was about a 20-hour period. Um, the kind of the cool part of that story is one of our managers lives close to a facility that we just couldn't find that last computer that was still impacted by the ransomware. So he actually went out, drove to this particular facility, and started wandering around looking for the device. It ended up it was a printer. One of the Windows embedded printers was actually infected with this particular strain. So he wandered around. This was at 11:45 at night, and he ended up finding a security guard that brought him to a particular room where he thought this printer might be located. He opened the door, and it was I envisioned it was a lot like the Indiana Jones when they walk into the last scene and there's this warehouse full of boxes, right? And the boxes
Yep.
sort of disappears. He walked into this room and it was full of printers. It was the primary
No.
print location for this particular location. So high speed, multiple 100 pages per minute printers. And he's like, I have no idea which printer is affected, but it's probably in here. One of our intuitive engineers said, hey, let me print a print job to that printer a second. So sure enough, hit print, the printer spools up, the print job comes out, the manager knows exactly which printer's impacted. They walk over to it, puts a sign on it, and unplugs it from the network, and we all went home happy, ready to deal with the problem, having contained it completely, ready to deal with it the next day then and eradicate it from the network. So that's the success story. The leadership lesson there, and I'll give you just a little sneak peek, is really the teamwork, the camaraderie, having each other's backs and being willing to take action on that, and the promotion of that kind of a mindset is what we'll dive into a little bit more during the keynote.
Excellent, because I'm sure a lot of people are going, wait a minute, you said it didn't come in through email, It didn't come in through a network drive.
Yep.
It didn't come in from a web page. How did this ransomware get in the system?
We'll
So,
we'll talk
and
about it.
that is perfect. That is enough of a hook for people to say, "Wait a minute. Those are all the regular ways stuff comes in."
Yep.
So, what happened to these guys that this got in?
You
So,
got it.
that is a great way to end this podcast. Thank you very much for being patient as well as being a mentor to me. And hopefully, this wasn't too boring for you.
Not at all. And thank you, Aaron. Your
Excellent.
passion for information security is actually motivating and contagious at the same time. So thank you for all that you do as well.
Well, thank you. I very much appreciate that.
Have you any idea why?